Guerrilla Psychology, Undercover Psychological Counselor. Life is not always wonderful, joyous, and serene. In fact, life is by its very nature full of ups and downs. Sometimes life is downright tough and painful, scary, exceedingly difficult, and even treacherous. There are times in everyone's life when we all experience a sense of despair and sorrow, and this may send us into an emotional tailspin. When life becomes simply too much to handle, a person may crack under the pressure. Sometimes life becomes so painful and depressing that an individual may be unable to cope with the stresses of everyday life. At this point, they may suffer a debilitating mental breakdown and find themselves placed in a locked psychiatric hospital facility. These locked psych units are designed to provide a safe haven for those experiencing a psychiatric emergency. To be admitted to a locked psychiatric facility, one must usually be considered a threat to oneself or to others. Patients in these locked psych units often find themselves in an extremely vulnerable mental state. Adding to their fear of being hospitalized, these patients must also face the realization that they have lost their freedom. Losing one's freedom can instill a great sense of loss and sadness. These feelings are intensified when these patients find out that they cannot leave the hospital until their psychiatrist feels they are well enough to safely re-enter society. Being locked up adds to the patient's insecurity, and it also puts them under a tremendous amount of additional stress. The thought of being confined to a locked psych unit also adds to these patients' level of fear and paranoia. These locked psych units are supposed to be a safe haven for patients, but to most patients, they feel more like a prison with no escape. Unfortunately, these locked psychiatric facilities are not ideal places for these patients to seek refuge from a chaotic world, but it is the best option our society presently has to offer. Psych techs are mental health professionals who have specialized training to work with patients in these locked psych units. Their main goal is to keep a watchful eye on the patients and to make sure that they are safe and well taken care of. These psych techs are specially trained to help patients going through an emotional crisis. Psych techs sometimes help patients by simply listening to them as they work through their personal struggles. These psych techs interact with the patients in these hospitals more than anyone else at the facilities. Psych techs not only assist patients, but they also work with hospital administrators, psychiatrists, and other staff members. Unfortunately, these psych techs usually do not have a great deal of time to work with patients because they are so busy with their many other tasks. This means that patients are basically on their own as they struggle with their psychiatric crises. There must be some way to improve the conditions in these locked psych units and at the same time improve the lives of the patients residing in them. One way that may help is for these hospitals to employ a highly trained, highly skilled psychologist. This psychologist would not be a typical clinician. No. This psychologist would be admitted to the locked psych unit as a patient and placed with the other patients in the unit and treated the same way as any other patient. This inpatient psychologist would experience firsthand what all the other patients are going through while being confined to a locked psych unit. While inside the psychiatric facility, this undercover therapist would counsel those patients who are most in need when they need it most. This is when therapy is most effective. This counselor could also perform mental triage, finding those patients most in need of counseling and treating them first. As the therapist works closely with the patients, this will help instill a powerful and lasting trust and allow for a deeper bond to develop and flourish. These intense emotional interactions between the patients and the therapist will help bring about a series of cathartic healing moments. The basic idea is simple. A highly trained psychologist would be admitted to a locked psychiatric facility as a patient. Once admitted, they would then begin to counsel the other patients. This undercover, inpatient psychologist would soon earn the respect and trust of the other patients by offering them the help they so desperately want and need. This counseling would take place when the patients are most in need of therapy, when therapy is most effective. Because this therapist is also a patient, they will have many opportunities to counsel the other patients anytime during their stay. This means that this therapist could counsel patients whenever they feel the need for it. This is a new style of counseling, quite different from traditional therapy. This new therapeutic approach is conducted while patients are experiencing an emotional crisis. This is when therapy has its greatest impact. This type of emergency inpatient counseling is known as guerrilla psychology. It is high-quality therapy made available to patients when they want and need it most. Conducting therapy under conditions like these will allow cathartic healing to take place relatively quickly. When it comes to therapy, it's not the amount of time spent with a patient that is important. No, what really matters is the quality and timing of the therapy.